Many patients feel the most overwhelmed immediately after they have their ostomy surgery. Many of you may still be on a variety of medications and feeling tired. Additionally, this is usually the time when you are expected to take in a lot of information about your medical supplies, do's and don'ts, and discharge information. In this third video of the Patient Bill of Rights series, we'll go over a few essential patient rights for the period immediately after your ostomy surgery. Getting the right information, education, and support immediately following your surgery can make all the difference to the process of adaptation and your overall recovery. Remember, you or your designated patient advocate should receive all of the following before you're discharged from the hospital and while receiving any home care. As stated in the first video of this series, counseling, care, and educational instruction should be culturally sensitive and in a language and at a level of understanding suitable for you. Following surgery, a doctor or nurse should give you personalized instruction and help you understand how to take care of your stoma. This should be information that is specific to your type of ostomy, age, gender, and lifestyle. You should learn how to clean your stoma, properly apply your ostomy pouch, empty your pouch, and replace it. You might want to have a caregiver or family member with you when receiving this information. Before you leave the hospital, you or your caregiver or family member should be able to demonstrate that you can do it on your own. If you are feeling a little unsure of your skills, your doctor and ostomy nurse can help you decide if you need further assistance by having a home health nurse in your home. Your nurse or doctor should also have an information session with you where they help you understand some common issues faced by ostomates, such as skin irritation around the stoma, prolapsed stomas, blockages, hernias, and how to prevent and treat them. Before you're discharged, you should be provided with verbal and written information about any changes you must make to your diet. These should include guidelines on how, when, and what you can eat and drink in the weeks following surgery, any foods you should avoid, and living with your ostomy based on your ostomy type. Dehydration is also a risk for ostomy patients, especially for someone with an ileostomy. It's important to learn fluid guidelines and avoid emergency room visits due to dehydration. Figuring out how and where to get your ostomy supplies can be difficult if you're not taught how to do so. Your nurse should inform you about your various product options, how to choose the best products for your unique needs, and walk you through how to order supplies, with and without insurance. Before you leave the hospital with your prescription and enough supplies to last you until your first shipment arrives. In 4 to 6 weeks following surgery, your stoma size may change and you may need to reevaluate the supplies you are using to ensure a proper fit. Remember, you have options. You don't have to only use the ones provided by the hospital, especially if you find they are not working well. When looking at other options, you should work with a certified wound ostomy continence nurse or ostomy specialist to find the best fitting and effective pouching system for your stoma. You can always request samples from manufacturers or your supplier to try new and improved products. Before you leave the hospital, make sure you get a list of support groups in your area as well as online resources. You are not alone. Different people have different emotional reactions to their surgeries. For some, it will be a problem, and for others, a challenge. Where one person considers it life-saving, another finds it a devastating experience. Each person will adapt or adjust in their own way and in their own time. Peer support from UOAA-affiliated support groups can be critical to a patient's quality of life and acceptance. Ask your nurse to point you to ostomy-specific educational resources so you can continue to educate yourself at home. If you feel your rights are not being met, speak up, ask questions, share the Patient Bill of Rights, and be as involved in your care as possible. You can be a force for change. Please go to ostomy.org to download the Patient Bill of Rights and get more information about UOAA.